Good afternoon. My name is Dr. Jeff Deaton, and I'm an associate professor at Wake Forest Baptist Health. And I just want to thank you for joining our chatting today. And I want to thank WFMY for hosting this event. And with that, we'll get to the questions. So I see one question already: what causes infertility? There are many causes of infertility, but there are probably 4, 5, or 6 that are the big ones that account for most couples. And so if you look at the big categories of infertility, I would say the biggest ones are male factor infertility, or problems with sperm count or sperm motility. Another big category is anovulation, or women who don't ovulate. I'm sure many of you have heard the term PCOS. There's a common condition in women where they don't ovulate, which means release an egg. Another common category is pelvic disease, either blocked fallopian tubes or pelvic scar tissue or endometriosis. Another big category is what we in the field call diminished ovarian reserve. But what that just means is few eggs. Like women who are approaching menopause don't have many eggs, and those eggs tend to be less quality. Those are kind of the big categories. That's not all inclusive, but those are the big ones. Another question: how is infertility diagnosed? Well, having just answered that first question, it's obvious that we kind of focus our approach to kind of ruling out those major causes first. We obviously can get more detailed and more specific if we don't find a cause early on, but we kind of do our testing early on to come up with, do you fall into one of those big categories? And I'd say about 90-95% of couples that come in will fall into one of those categories I just went through. So we always do a sperm test to see what's the count, motility. A male factor evaluation is an early part of the process. We always do a test to see if the woman's ovulating. There's always a test to see if the fallopian tubes are open. And then we also do blood work to see, is there a reason why she's not ovulating? And what is her ovarian reserve? What is her egg quality? We call ovarian reserve and egg quality kind of the same thing. And so we kind of go through those 4 or 5 basic tests: blood work, a hormone panel, a test of egg quality, a semen analysis, and then a test to see if the fallopian tubes are open. At that point, we often will know why they're not getting pregnant. We can begin to tailor our treatments. If we don't have a cause, some couples do fall into what's called unexplained infertility, which just means we don't know why they're not getting pregnant. Luckily, it's a small percentage. It's only about 5%. Another question: do you recommend genetic testing when going through IVF? That's a very complicated question, and you will get different opinions from different people. So let me just give you a little background before I answer that question. First, if you take women under 35, about a third of her embryos that she forms from in vitro fertilization, a quarter to a third of them that look perfectly normal will actually have a genetic defect. But 2/3 don't have a genetic defect. If the woman's 38, it's about half and half. So in 38-year-old women, about half the embryos that are formed have genetic defects and half don't. And obviously, as you get older into your 40s, the number of genetic defects increases. And so in young women, we don't push genetic testing. But if there are a lot of embryos and the couple is having 1 or 2 put back into her uterus and the rest are frozen, if you're freezing genetically abnormal embryos, you often put her later on through embryo transfers that lead to either failures or miscarriages. And so you can make a strong argument, and this is kind of where I am on this, to do genetic testing, because then you can use only genetically normal embryos, reduce her miscarriage risk, and reduce her failure rate. And so I do think it's a great test to do. It does add a little extra money to the cost of the procedure, but it does give valuable information. Another question: how long would you try the natural way until you would decide to try fertility treatments? That kind of depends on a few factors. One, it depends on the female age. As you have probably gathered from a question a minute ago, female age is very important to fertility. And so we don't recommend women who are over the age of 35 to try more than about 6 months, because that time could be very valuable. So we recommend those women that are in their upper 30s, early 40s, coming to see us quicker. But if you're a younger woman, the basic definition of infertility is 1 year of unprotected intercourse without a pregnancy. So we would recommend you try for about a year. However, if a woman's not having periods, which means she's not ovulating, don't waste a year trying. Come see us quicker. If you know for a fact your husband's got a problem, don't try for a year. Come see us quicker. So it kind of depends on your situation. But if you're a young woman who is having regular periods and ovulating, and with a partner that, as far as you know, has normal fertility, then I think trying a year is a good idea. If you're older, shorten that up a little bit. Okay, how many times would you try IUI before trying IVF? Let me go ahead and give you a little quick summary of what the difference in those two things is, because some may not know the difference. IUI stands for intrauterine insemination, and that's simply a process where we process the sperm sample and then put a small sperm sample with very mobile sperm into the woman's uterus. That's an IUI. So it's a very simple procedure done in the office, does not require any anesthesia, fairly straightforward. IVF is in vitro fertilization, which is much more complicated. In vitro fertilization, or IVF, is where we take eggs out of the woman's ovaries with a procedure where she's sedated, and then we fertilize the eggs in a dish, create embryos, and transfer 1 or 2 embryos back into her uterus. So IVF is the much more invasive, costly procedure. It's still all done in the office, but there's just much more to it. So now back to the question, how many times would you try IUI before doing IVF? Most pregnancies with IUI therapy occurs in the first 3 cycles. So we kind of recommend embarking on 3. It doesn't mean you can't do 4, but after 3 to 4 tries of IUI, your success rate with IUI begins to diminish. And so we kind of, especially when there's a male factor, we don't recommend doing more than 3 or 4, and then at that point banking your resources towards in vitro fertilization if you've not been successful with IUI. Next question. How old is too old for fertility treatments? I've heard of women having children in their late 40s. Yeah, another complicated question. So as you've learned already, the female age is very important. So if you look at natural fertility, or even treatments we do, in women over the age of 45, pregnancies are rare. And so we don't encourage women to go through aggressive treatments over the age of 44 to 45 using her own eggs. However, we actually have the option of using donor eggs. And when a woman uses donor eggs, her uterus doesn't age, so she can carry a donor egg pregnancy well into her upper 40s. And so to answer your question, if you are wanting to try with your own eggs, we will not get aggressive beyond the age of 44 to 45. And that's just because the success rates are approaching 0 and it's a waste of money. If you're willing to use donor eggs, then we will be willing to take care of you and treat you up into the age of 50 or so. We don't recommend in this country doing donor eggs in a woman beyond the age of 50 years old, but we can do it with great success up until into the upper 40s. Next question. Why does artificial insemination work 1 cycle and then not any longer? I'm not sure I totally understand that question. The success rate from inseminations is constant through the first 3 to 4 cycles. Now, if you're using donor sperm, which is, I don't know if that's what they're asking or not, but if someone is using donor sperm, the success rate stays constant for longer than 3 to 4 cycles. So it actually often works the first cycle, and then when you come back for a second pregnancy, it might take 3 cycles. That's just statistics. So it's like a fertile couple who's trying to get pregnant. Some couples hit it the first month, other couples take 4 months. Some couples have to come see us. And so the success rate stays pretty constant for several cycles, but it doesn't always happen the first cycle. I hope I addressed that question. I wasn't totally sure if I addressed that one. Next question, does doing IVF help to prevent or at least lessen the chance of a miscarriage? Actually, I wish it did, but it doesn't. So your miscarriage risk is the same regardless of how you get pregnant. Whether you get pregnant naturally, with insemination, with in vitro fertilization, you kind of run the same miscarriage rate across the board. And the miscarriage rate is obviously tied to the female age. So a 38-year-old woman who gets pregnant with in vitro, unfortunately, has the same miscarriage rate as any 38-year-old woman who gets pregnant on her own. Now, the only way I know, let me finish up and just finish that question. The only way I know to decrease the risk of miscarriages is to do that genetic testing that we alluded to a while back. So if you do in vitro fertilization and you test the embryo and you know it's a genetically normal embryo, that miscarriage rate drops down below 10%. If you don't know the genetics, the miscarriage rate is between 20 and 25%. And so that's another reason to consider genetic testing, because it does lower the miscarriage rate to a much lower number. Next question. Will fertility treatments put me at risk for female cancers such as breast cancer or ovarian cancer because of the increased amounts of estrogen, etc.? So there were two studies back in the 90s that linked fertility drugs to ovarian cancer. But there were some flaws in those studies, and later studies that tried to determine if there was an association could not determine that association. So we don't really believe there's a linkage between fertility drugs and fertility treatments and cancers. However, there are studies that would suggest there might be. If there is a risk along those lines, it's a very, 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 very small bump up in the risk. And I personally don't believe that risk exists. Next question. Is there anything I can do to protect my fertility for the future? There are some things that we know cause infertility. And let me run through those and talk about how to protect yourself. One thing that causes infertility are sexually transmitted diseases. So there are women that acquire sexually transmitted diseases that get blocked fallopian tubes. And if you have blocked fallopian tubes, those women who want to get pregnant need IVF. And so if you think you might have an STD, make sure you seek help quickly, because early and quick treatment can prevent the negative effects of a sexually transmitted disease. We also know that smoking lowers fertility. So if you're a smoker, I would encourage you to stop smoking. That effect we think might be reversible, though. The STD effect in getting a blocked fallopian tube, that's not reversible. That happens, and you got to deal with it using IVF. But those smokers, if 6 months to a year after you've stopped smoking, your fertility ought to be restored. We also know that female age is important in terms of getting pregnant. Now, I'm not suggesting you rush and get pregnant ahead of your schedule, but if you are wanting to delay a child until your 40s or in that range, some women now are actually having their eggs frozen. It's a new technology that's kind of exciting, and so those women who do not want to have children yet or in their 30s and they want to wait, that's perfectly fine. Now, if you want to wait, you can always have your eggs set aside so that when you do want to have a child, you can use your frozen eggs. Those are the big ones. There are some other ones, but those are the main ones. My mom had miscarriages and trouble getting pregnant. Does this increase my chance of having the same problems? Luckily, I can say no. Miscarriages are very common. We actually touched on miscarriages a couple of times today. So let me just talk a little bit about miscarriages. The vast majority of all miscarriages are due to genetic defects in the fetus. And so these are just random things that happen. They're very unfortunate, but they're just random. It's not because of any fault in the mother or the father. But when the sperm and egg come together, often there's kind of a misfire, if that makes any sense. And it creates an embryo and a fetus that has not the right number of chromosomes. And those fetuses miscarry. And so the vast majority of all miscarriages are simply that, a kind of a misfire, a genetic defect in the fetus. And those are random events. And so if your mother had a miscarriage or two, it was probably a random event, which means you could have one or two, or you could have none. It's not related to what your mother did. And the same thing with getting pregnant. The only thing that is a little genetic in terms of getting pregnant is we've learned over the years that women go through menopause about the same time that their moms go through menopause. Not always, but if your mom went through an early menopause in her mid-30s or late 30s, there is a chance you'll do the same thing. So again, I'm not trying to say go out and have a child ahead of your schedule, but if you are in your 30s and your mom went through early menopause, you might want to seek help. Check that blood test we can check about egg quality, and then make a decision whether you want to move up your time frame or set aside frozen eggs or whatever. But except for that, all the other fertility issues and miscarriages are not genetic in terms of passing down from mother to child. Good questions, by the way. Next question. I had a friend that did IVF and was very conflicted on what to do with the leftover embryo. What are the options with the leftover embryos? Yeah, this is again a complicated question, but I really like these kind of questions. It's one reason I enjoy what I do so much. I love the ethics and the kind of conundrums that we face with infertility, and this is a big one. And so if you do in vitro fertilization, we tend to only recommend putting back 1 or 2 embryos in most women. Now, women in their 40s will often do 3, but it's mainly 1 or 2. And many women create many more than 1 or 2. So then you have a dilemma. What do you do with the extra embryos? We recommend freezing the embryos, which gives you options down the road of what to do with them. What I'm getting at is if you have frozen embryos set aside, then the second try to get pregnant is much, much, much easier, and is also much cheaper than the first try. So the first try with in vitro fertilization is where you take all the shots, you go through an egg retrieval, you have embryos created, and then you freeze some. That's a big investment. But if embryos are frozen and you want to try again, the second try is much simpler because the embryos are already created. You simply thaw them out and put them in. Of course, you have to prepare the uterus, but it's not as complicated as the first try. And so we do recommend freezing embryos because if the first cycle doesn't work, or if you have a child from the first cycle and want a second child, it's much cheaper and much simpler to come back for the frozen embryos. Now, if you have frozen embryos, then it's your decision, you and your partner's decision, what happens to those down the road. So that if 2 years later you decide you don't want more children, then you can choose to either donate the embryos to another couple, which gives the embryos a chance, and gives another couple a chance of having a child that they might not have, or you can choose to have the lab discard the embryos. We love it when couples donate embryos. There are a lot of couples out there that would love to receive a donor embryo. And so if you are of the mindset that these are life and should be protected, you can donate them if you don't want more children. But again, it's totally up to the couple. We don't get to make that decision. It's totally up to the couple. Next question from Angie. I've always heard that if you do IVF that you have a good chance of having twins or triplets. Is there any truth to this? Well, it's a yes and no question. So it's totally based on how many embryos you put back into your uterus so that you have control of it. So the nice thing about in vitro fertilization is that we can create 20, 30 eggs, make a bunch of embryos, but then only put one back, which limits the twin rate and virtually eliminates a triplet rate. So yes, there are a lot of twins from in vitro fertilization, but that's because the couple chooses to put back 2 embryos. And we're big proponents of doing what we call single embryo transfers. So we do believe it's important for us to limit twins as much as we can. And so if you have high quality embryos, we will encourage you, unless you're over 37, we'll encourage you to put back 1 embryo. Now, having said that, if you as a couple say, well, we understand you want us to do 1 embryo, but we want to put 2 back, we will try to honor that and put 2 back. But that's why you get a lot of twins. So if you put 2 embryos back in a young woman and there's a pregnancy, The twin rate is about 40%. So we do try to limit twins by putting back one embryo at a time. Let me just finish that because I don't think I finished the question. But triplets with in vitro fertilization are very, very unlikely because we do not put back a bunch of embryos. We put back one or two. So the chance of having triplets is very low, but embryos can split. And so we can, if we put back one embryo, there's about a 1% chance it'll split and become a twin. Put back two embryos, there's a chance one of those will split and become a triplet. But they're very unlikely with one or two going back. Can fertility treatments have a negative impact on your immune system? Good question. I think I'll keep this one kind of simple and say, in my opinion, no. Now, the stress of going through fertility, I believe, can have an impact, because if you're stressed out, not sleeping, so on and so forth, then that can affect your immune system. But the actual treatments themselves, I personally don't believe affect your immune system. But it is stressful, and so I'd recommend if you go through fertility treatments, especially in vitro, that you make sure you have somebody you can talk to and kind of walk through it with you, because it can be a very stressful process. Are there any vitamins that my husband can take to help with his fertility? Well, first of all, find out if he has a problem with his fertility. So if he's been tested and it's normal, then whatever he's doing with his diet, lifestyle is fine. But if he's been tested and he's mildly abnormal, then studies have shown that vitamins can help. I'm not going to go through all of the different vitamins, but I will say that the vitamin companies now make these things they tend to call fertility blends for men. So the GNC, the vitamin companies, if you go there and say, I need a fertility blend for a man, they can point you to the right product. But we do know that zinc and magnesium, vitamin E, there are certain things that are important for sperm production. So if he's been tested and has a problem, but it's a mild problem, then you may want to get him on vitamins. Okay, next question from Cece. My husband and I have been trying to have a baby for well over a year, but have not had success. We have done all the testing that we can do, and no one can find anything wrong with either one of us. Is there a reason why two healthy people that seem to not have fertility issues would have problems getting pregnant? So it's hard for me to answer that, CC, unless I've seen all the testing, right? And so I do trust that you've had all the testing, but it may be that someone will look at your situation and say, well, what about another test that you haven't had done? But I will say that even in a program like ours that focuses on fertility and does a lot of this, that in a program like ours, there's about a 5% chance that we would find a couple with what's called unexplained infertility, which means we can't find out why they're not getting pregnant. So yes, there are couples out there that we cannot determine why they're not getting pregnant. It doesn't mean there's not a reason. I want to stress that. I do believe there's usually a reason for it. We just we don't have the technology necessarily to find it in about 5% of our couples. But I also will say there are a lot of tests to be done, and it's possible you haven't had tests that might open the door to why you're having trouble getting pregnant. What exactly is the difference between IVF and IUI? And this is from Nikki. So IVF stands for in vitro, which means in glass, in vitro fertilization. And that means that the fertilization is happening outside the body. IUI stands for intrauterine insemination, which means the fertilization is happening inside the body. So with IUI, it's a process where usually on the day of ovulation, and we time this so that we know, we often give the woman fertility drugs, do ultrasounds, we make sure there's good egg production, and then we actually give a shot to make the eggs release, which is causing ovulation. So often on the day of ovulation, if we're doing an IUI, we'll bring the couple in the day the eggs are releasing, and we will get a sperm sample. We often will process the sperm. We have to wash it to get the sperm out of the ejaculate, and then we will kind of jazz them up a little bit, put them into a little bitty catheter, and put about 1/3 of a cc of liquid with a lot of mobile sperm into the woman's uterus. That gets them about halfway to where the egg is. So when a woman ovulates, the egg goes out of the ovary and goes into the fallopian tube. and it stays in the fallopian tube, kind of waiting for the sperm. And so we put the sperm into the uterus about halfway to the egg, but the sperm still have to go the rest of the journey and fertilize the egg. So we need a fairly good sperm sample to even try an IUI. So IUIs are done in the office. There's no anesthesia. They're virtually painless in almost all women. And most women lie there 15 minutes and go back to work and go back to full activity within a few minutes. And they're not nearly as costly as IVF. IVF is the high-tech thing we do where we stimulate the woman to make a lot of eggs, and then when the eggs are ready, we take them out of her body with a needle. For that process, she is kind of knocked out with a medicine called propofol where you kind of sedate her. And it takes about 30 minutes or so. We take the eggs out of her ovaries. Most women, after the egg retrieval, go back to work the next day, kind of lay low, relax that day. And then the day the eggs come out, we get a sperm sample and we fertilize the eggs. And sometimes when there's a significant male factor or a sperm problem, we actually inject the sperm into the eggs. That's called ICSI. Other times we just simply put the sperm near the eggs and let the fertilization occur more naturally. And then after the egg retrieval and the fertilization event, we wait 5 days, ideally, and most women we wait 5 days, and we put 1 or 2 embryos back in the uterus. That whole thing I just went through is called IVF, or in vitro fertilization. It's obviously much more aggressive, there's much more involved, but it's also the primary treatment for some couples. So couples that have a severe sperm problem or blocked fallopian tubes, their only option is in vitro fertilization. They can't go through inseminations. So some couples come to see us, and from the first visit, we just go straight into IVF. Other couples, we try fertility drugs. We might try IUIs before we get to IVF. Next question. I don't smoke, but my husband does. Could that have an effect on our fertility issues? It could definitely affect your fertility issues, but the best way to be to find out is it affected him or not. We don't think smoking is a major factor in male factors. We don't think it's a major reason why men have abnormal semen analyses. Secondhand smoke could affect the woman, but you'd have to get quite a bit of secondhand smoke. So I don't think it's as big of a deal as if you smoke, but I would obviously encourage your husband to consider stopping. Even if it doesn't affect his fertility, it would affect a child. And so I would encourage any couple getting ready to have a child to try to make their lifestyle, their environment as good for that child as they can. Question from Yolanda. I'm having trouble getting pregnant, and if I hear, if you don't try it will happen, one more time I'm going to scream. Is there any truth to not try it? Well, Yolanda, there's actually no truth to that. And this has been studied. So they've looked at couples who have given up and then gone on to adopt. And, you know, we all hear that same old wives' tale that if you just adopt, you'll get pregnant. There's no truth to it. That's been studied. So they've looked at couples who actually did that. They went through fertility, they adopted, and they didn't have any higher fertility afterwards. The only difference is when that happens, we kind of remember those women, right? So that's kind of a story you remember. But you're not remembering all those women who adopted and did not get pregnant. So there is no truth to that. So so I know people mean well, right? So when all these people say things, you know, just don't worry about it, you're too stressed out, they all mean well, but there's no truth to any of that. Another question. How long should my wife and I try without her getting pregnant before we should go see a specialist? So this is based on a couple of factors. One is your wife's age. It's not the man's age is not as important. So men maintain fertility most of their lives, and women at some point will begin to have a drop in fertility, and then at some point when her eggs run out, she'll run out of fertility. And so if you're under the age of 35 and she's having regular cycles, regular periods. If she's under 35, regular periods, I think trying a year is not bad because some couples do take longer. But if you're over 35, if your wife's over 35, and you've been trying for 6 months, I wouldn't wait much longer. I'd go ahead and get in to see somebody. And also, if she's not having regular periods every month, or there's something in her story that's worrisome, go see somebody sooner. It's always good to get plugged in earlier. That way you don't waste a lot of your time trying if there's absolutely no reason you can get pregnant naturally. Next question from Amanda. Does eating unhealthy or drinking soda affect fertility? So I think the main effect there is in obesity, right? So we do know without any doubt that a woman's weight and a man's weight actually both affects fertility. And so if you are leading an unhealthy type lifestyle, then there's a chance, this may not be your story, but there's a chance your weight is getting up there. And if your weight is high and your BMI is high, then that lifestyle is affecting you, and I would try to eat healthy. Again, though, I'd also say, having a child is a good time to kind of look at your life in general, and it's a good time to try to make your life, as good as you can, a good environment for a child, because I guarantee you, I see a lot of couples who come in who are smoking or eating unhealthy foods, and they all say, oh, as soon as I get pregnant, I'll stop that. And of course, my comment is, well, then, if it's that easy, stop it now. Make your environment a good place for a child. So I would encourage healthy lifestyle, healthy living with how you eat, exercise, because weight does affect fertility. Okay, this is a good one. So this is from Tracy. I don't mean to be crass, but is there a better sexual position that might help with pregnancy than another? It's a great question, actually, and it's one of my more common questions I get. And the good news is the position doesn't matter. The reason is that this has been studied too. When a man ejaculates into the woman's vagina, within seconds, sperm have gotten into her cervix. So if she's fertile, which means within a few days of ovulation, so a woman's only fertile for about 3 to 4 days before ovulation. So the rest of the month, sperm can't get in, right? So no matter what you do, you're not going to get pregnant. But for those 2 to 3 days, 3 to 4 days before ovulation occurs, the woman's fertile. In those 3 to 4 days, when the ejaculate's put on the cervix, within seconds, sperm get in. And so the position doesn't matter, because no matter what position a woman's in, the cervix receives the sperm with ejaculation. Next question from Liza. Are there ever symptoms of infertility? Well, it may depend on what you mean by symptom. I mean, obviously, not getting pregnant is the main symptom of infertility. But of course, there are things you want to look at. I wouldn't call these symptoms, though. But there are things that ought to be concerning that you might want to think about. For example, like I said earlier, BMI is very important. So if her BMI is high and she's overweight and her periods are irregular, that would be a symptom of infertility. Smoking, like I said earlier, if you notice that there are some men that have low volume with an ejaculate. So if you notice that there's not much fluid with an ejaculation, that's kind of a symptom also. And so, yeah, there are a few things like that I would point you to. But mainly look at your cycles. Women should have monthly periods. That means they're ovulating every monthly. Next question from Hannah. Hello, I'm 37 and I've been diagnosed with PCOS. I've been unable to conceive. We've seen a specialist who is insisting on IVF. There are twins on both sides and we are afraid of multiples. Are there any things I can do to help conceive naturally without having to take medications? So Hannah, I'm assuming from your question that you're not ovulating normally. Either you're having irregular cycles or someone's determined that you're having monthly periods and you're still not ovulating, which is possible. And so I'm assuming that you're not ovulating with your question. And so if you're not ovulating and you're overweight, one thing is you could try to lose weight. Now I know it's hard to lose weight. I don't mean to be simple-minded when I say that. But if you're young, well, you said you're 37. but if you are overweight and not having regular cycles, sometimes losing weight can restore fertility. Now, if the only thing y'all are dealing with is PCOS, if there's nothing else wrong, most of those women actually don't need IVF to get pregnant. They get pregnant with fertility drugs. The problem is fertility drugs have a higher rate of multiples than IVF. And so if you're 37 and you're afraid of multiples, you could always try the mild fertility drug first. There's a first-line fertility drug called letrozole or Femera, and it has an 8% twin rate and a less than 1% triplet rate. So it's a mild fertility drug. It doesn't have many multiples. So we often, in women that are kind of afraid of multiples, we'll often start there, and then if they are not getting pregnant, then IVF sometimes comes into the picture because we can control the multiple rate with IVF. With IVF, we can develop 20, 30 eggs and just put back one embryo. So you can actually really limit your multiples with IVF. So I've kind of bounced around this answer here, but let me just say that if you're PCOS and there's nothing else wrong, I would definitely recommend trying some mild fertility drugs first. Now, if you're PCOS and your husband's got a male factor or there's pelvic disease or something else, then IVF makes more sense to go as a first-line treatment. And if you want to limit your multiples, I would not recommend doing the injectable fertility drugs because that's where you get a lot of the multiples. You can try the mild one, which is an oral-based drug, or you can do in vitro fertilization. Hope I didn't get too bounce around too much with that answer. You can always ask another follow-up question if I didn't quite get your question. Next question, does it matter whether or not the male gives his sample at the office or at home in a cup? Sperm are pretty amazing, right? They can live for a very long time. And so as long as we get the specimen within 45 minutes, we don't care where it's collected. In fact, if you collect it in the office, it actually just sits there for about 30 minutes to kind of what's called liquefy. And so whether it's sitting there for 30 minutes in the office or you're in the car with it for 30 minutes doesn't matter. So believe it or not, it doesn't matter where he collects as long as he can get it to us within 30 minutes. Next question from Janice. Would any extracurricular activities that my husband may have done in college but not anymore cause infertility later on in life? Kind of curious what your husband's done, but I know that's not the question. Probably not, Janice. For example, let me give you a few things that men sometimes do early in life that they stop doing. Drinking early in life does not have any long-term effects. Current drinking can. I'm talking about more than social. Social drinking we don't think causes infertility, but men that are either alcoholic or borderline alcoholic have infertility issues. But if that was a thing early in life, that's not an issue now. Drug use early in life, as long as he doesn't do it anymore, should not be an issue now. Some men do steroids when they're lifting weights early in life. Those also reverse when you stop the steroids. So luckily, if he was a little wilder in college, that's okay. It probably is not affecting him now. Next question. Are there any risks involved in fertility treatments? The main risk with fertility treatments involve multiple births. So part of our job, part of my job and my partner's job is to limit multiple births. We try very, 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 very hard to avoid multiples, especially anything beyond twins. And so if you look at complications, they're often related to having a multiple birth because twins and triplets are much more complicated than singletons. Beyond the multiple birth issue, there are rare complications from doing an egg retrieval, but I'm talking rare. I've actually never had an injury doing an egg retrieval, but the study suggests if you do 1,000 egg retrievals in one of those women, the needle will injure an internal organ. Again, I've never had it happen, but there are rare complications from an egg retrieval. I wouldn't let that be the reason you don't do it, by the way, but there are rare complications. Finally, there are rare infections from what we do. So whenever you put a catheter into a body cavity, whether it's a uterus with an insemination or a needle with in vitro fertilization and getting eggs out, whenever you put an instrument into any bodily cavity, there is a tiny risk of an infection. In my 27 years of doing this, actually it's almost 30 years. In my 30 years of almost doing this, I've only had 2 infections in my life. And so they're very rare, but they do occasionally happen. Next question, does taking hormonal birth control for many years increase my likelihood of infertility when I'm ready to have kids? No, the good news is hormonal birth control clears out of your system within a couple, 3 weeks of stopping the pills. So you can take pills as long as you want and then stop them and try and get pregnant. In fact, there are some health benefits to being on birth control pills and having regular periods and so on. So it's perfectly fine.
We've gotten a lot of comments with people wanting to thank you for helping them get pregnant on Facebook. So just wanted to share that with you.
Well, thank you. I love what I do. So it's always good getting those comments. So comment from Whitney. My husband and I have been trying for 3 months. I am not patient at all. I actually had an appointment with you 2 weeks ago, but canceled because I thought I should wait longer. Well, I hope you get pregnant. I hope you don't have to come see me. I'll just say that from the get-go. Any tips on staying calm? That's a great question, Whitney, and I will tell you that infertility is one of the roughest things couples will ever go through. It's a terrible trial. It's stressful. I've seen it tear apart marriages. And so I'm just going to tell you, it's hard to stay calm because this is probably one of the most important things in a couple's lives. And the most important thing in your life, you've kind of lost all control about. So I totally get it. Let me say a few things to stay calm. One is keep living your life. It's very important in the midst of any trial, any suffering, anything you're going through that you keep living. I've seen too many couples kind of decide, well, I'm not going to buy the house, or I'm not going to take the trip, or I'm not going to get the new job because I might get pregnant. I think that's the wrong way to look at it. You need to keep living your life in the midst of your struggles. That's one thing. Secondly, I think it's good to have a person or two you can talk to, but I would encourage you not to put this out there for the world. So I don't think it's good to go through these things alone, and most people have a tendency to go be alone. I think that's unhealthy. But I don't think it's also good to tell everybody in the world, because what will happen is they'll start telling you things that they mean well, but they're just not helpful. And then once people know you're trying to get pregnant, then everybody, you kind of become defined by it a little bit. And so I would encourage you to have people you can talk to, close friends, but not just to tell everybody in the world. Third, I would also tell you that you are in control of this process. You think you've lost all control, but you are in control. And so, there are a lot of treatments. You can choose to do treatments. You can choose not to do treatments. You can choose to adopt. You can choose not to adopt. You can choose to stay as a child-free couple and enjoy life as a couple. So there are a lot of options you have, and I would encourage you to try to regain that control a little bit, and take the time to make a healthy decision and the right decision. And just fourth, and I don't know if I'm number 4 or 5, but just, again, maintain your other interests, right? We all have hobbies and interests and things we love to do. And often in the midst of a trial, we'll hunker down and we'll stop living, we'll stop enjoying traveling, or we'll stop whatever. Again, don't do that. There is hope. You will succeed, I believe, whether it's through adoption or getting pregnant through a fertility treatment, or you'll get through this. All storms come to an end. All trials come to an end. They don't last forever. Next, how do you recommend starting the adoption process? So, adoption is very complicated, but once you get a sense of how you want to adopt, then you can be pointed in the right direction. What I mean by that is there are kind of 4 basic ways to go through an adoption process. And one way, and let me just kind of go through the 4, and then if you decide which of the 4 works for you, then it's easy to get pointed and get started. So one way to adopt would be to do it internationally. It's becoming very popular because there are more children in the world than there are parents who want children. It's kind of reversed for American children. For every 1 child born in America, there are about 50 couples who want to adopt that child. So it's harder to adopt. So international is becoming popular. And so one way is to do it internationally. We have a wonderful agency right in our region that only does international adoptions. They're very good at it, called Carolina Adoption Services. The second way to adopt is to go to an agency and say, we want a healthy infant. Now, this is like Children's Home Society, Lutheran Family Services, Catholic Social Services. I could name a bunch of them. Now, these are agencies where they sometimes have children to be placed, but I'll be honest, the agencies are not getting as many children, and so often the waits through agencies are a long time. Not always, but they can be a long time. And so this might work if you're younger and you got time on your side to go to one of these agencies and just kind of wait for a healthy infant. A third way to adopt is to do what's called a private adoption, where you would kind of locate your own birth mother and then through a good lawyer work out the adoption process. This is the way that's a little scary for people, because if you locate a birth mother who's younger, who wants to place her child, she can change her mind and keep the child, and there's nothing you can do to change that. The laws protect the birth mother over you as an adoptive parent. And yet sometimes it works beautifully. It's very quick. And so if you decide you want to do a private adoption, then in the state of North Carolina, doctors can hook up patients to young women who want to place their child for adoption. And so you have to kind of go find the birth mother kind of on your own. So you have to just begin a network, talk to everybody, however you want to try to find a birth mother. If you find a birth mother and you want to adopt, you got to get a good lawyer who knows exactly how to make this correct. And so there is an agency or a society that's called the American Academy of Adoption Attorneys. And these are attorneys who are good at adoptions, and I would encourage you to get one of them. The fourth way is kind of special needs, where you're willing to take a child that's hard to place. Now, some children get labeled hard to place, and it's kind of not fair, right? So, a 3-year-old child that might be perfectly healthy, when they get beyond 1 or 2, they get hard to place. Biracial children are hard to place. And so there are a lot of children that are hard to place. Sibling groups are hard to place. And so if you want to adopt a special needs type child or a child that's just hard to place, that's all done through your county Department of Social Services. And so basically there are 4 basic ways: a private adoption, an agency adoption, international adoption, or special needs type adoption. And once you decide on that, it's easy to point you into how to get it done. Question from Jenny. What advantage does Wake Forest Center for Reproductive Medicine offer over other local fertility practices? Will I be treated like a number or as an individual? Great question. And of course, y'all may know this, but I was actually at Wake Forest from 1990 until 2006. At that point, I left Wake Forest and went kind of into the Greensboro Northern High Point area. And then I'm just now brand new back at Wake Forest. I'm actually seeing patients primarily in Greensboro. So we have 2 centers now. We have a Greensboro location, which is up there on North Elm Street. I'm there most of the time. And then there's the Winston-Salem location, which is at Miller Plaza on Miller Street, and I'm there a little bit. And one of our advantages is we have these 2 nice locations. So no matter where you live in the Triad, you can get most everything done either in the Greensboro office or in the Winston-Salem office. So that's one advantage. Secondly, there are 4 of us who practice clinical infertility. There's actually a 5th person in our group who is one of the leading researchers in our country. But there are 4 of us who practice clinical infertility. And I'll be honest, I'm just loving working with these other 3 people. We're real balanced. We have different interests, different ways we approach things, and anything you need, one of us is providing. For example, I don't do much surgery anymore. I do in vitro and office infertility, but I have, my partners are very, very good surgeons. And so those women who might need surgery, we can take care of you. Those women who need in vitro, we have about the best rates, I think, in the state. And I can do that later if we need to talk about that. But our in vitro fertilization success rates are superb. Our single embryo transfer success rate, and this is with embryos where we don't know the genetics. So these are just untested embryos. Our single embryo transfer pregnancy rate is around 55%, which is a superb number, and that means virtually no twins. And that's in young women. So the field of IVF has gotten so good. I remember the day when rates we were happy with 10% success rate. Now we get 55% success rate with one embryo. And so we have excellent success rates. We're very balanced. And we have 2 centers that provide full service infertility. And we're also cutting edge research. And I think that's important. All that we do grows out of somebody studying it and determining what's the best approach for this or what's the best approach for that. And so we're in an environment of academics, which I think is vital to a successful endeavor like this. So we are always doing research protocols. We're around students and residents, and so we stay up to date. And so I think those would be what I'd say that would be advantages that we would have over other fertility centers. Comment from Jan. On average, how much does IVF cost versus IUI? Does insurance cover these procedures? So let me do the insurance thing first, and then I'll get into the money. In our region, there are several companies that provide infertility coverage for their employees. So when you look at insurance, it doesn't really matter whether it's Blue Cross or Aetna or Cigna. They just simply do what the employer primarily tells them. And so there are about a dozen to 15 companies in our region that pay for infertility treatments. For example, all the healthcare systems provide coverage for the employees. A couple of the big banks do. There are others too. So yes, insurance often does cover these treatments, but it's based on where you work, not the type of insurance per se you've got. And I'm a big advocate for encouraging employers to provide this coverage. It's cost effective, it keeps good employees, because infertility couples primarily are younger, healthy people. And so if you can tell your employer that providing this benefit is not only the right thing to do, it actually helps you maintain a good workforce, you can often convince them to add this to their coverage. So I've met with many companies. I'd be happy to if somebody out there wants me to do that again. So how much does it cost? So if you don't have insurance coverage, we do kind of package pricing. And so an insemination, an IUI, the actual IUI is just roughly $500. And that's 2 different fees. There's a fee to prepare the specimen, which is a lab fee, and then there's a fee to do the procedure. That's the physician fee. And they add up to about $500. So IUIs they don't tend to break the bank. I mean, they're not cheap, but they don't tend to break the bank. IVF is where it can get expensive. So the package price for IVF, again, it's hard to give an exact number because some couples need embryo freezing, some don't. Some couples need sperm injection, some don't. And so it's kind of complicated, but I would say the basic price for IVF is going to range somewhere between $7,500 and $10,000 based on what services you might need. So somewhere between $7,500 and $10,000. Now that does not include the medications, which are often $3,000 to $4,000, or $5,000, but that does include all the ultrasounds, all the egg retrieval, creating embryos, freezing embryos, putting them back. It's a lot of stuff that adds up to somewhere between $7,500 and $10,000. Next question from Jesse. Do you think the ovulation tests work? Would you recommend using them? So yeah, I do think they work pretty well. So the way they should work, let me tell you how they should work, and if this, and I do think most of the time they give you good information. So the urine test for a hormone called LH, luteinizing hormone, LH, and so LH is in your urine right about a day and a half before you ovulate. And except for that little window of time, it's not in your urine very much. And so the way the test should work is it's kind of negative for a day or two, and then it just shoots positive, and then it goes back to being negative again. And so if you're seeing that happen, then that's an accurate thing, and you're probably ovulating about a day to day and a half after you get that in your urine. Now, there are some women who have levels of LH in their blood all the time. And so those women often, they're not accurate. So if you're somebody who's testing and every day you test is positive, that's not accurate. You can't trust that. But if you get a negative, then a positive, you can trust that. And I do think they're helpful. We don't use them a lot in our office because we're kind of taking over your cycle. We're giving you hormones to make you ovulate, so we don't do it a lot in our office. But if you're at home trying, it's a good thing to do to know that you're ovulating. Because if you're not ovulating, don't try that year. Don't even try a few months. Come in to see somebody. We don't want you wasting time. So if you're not getting positive urine testing, you ought to come see somebody. Comment from Eve. I've heard that IVF involves a lot of shots. Can you elaborate and help me with my fears? Well, I can definitely elaborate. I'm not sure I can totally help you with your fears, but I'll definitely try to. So, yeah, there's about 10 days of shots to grow the eggs. So when you're having your period, your eggs, or your follicles actually, are small. The shots kind of grow them to maturity, and there are about 10 days of those shots. And what I can say is the needles are 30 gauge needles. Now that may not mean anything to you, but they are tiny, tiny little needles. They're about a ½ inch long, and they're the size of a hair. And so I've had countless women who come in and say, I can't give shots, and they all become pros at it. So don't worry about those shots. There are some shots that some women take of progesterone after the transfer. And so progesterone shots, unfortunately, do involve a bigger needle. But there are other ways to get progesterone. And so if you are someone who just cannot do those shots of progesterone, we have other options. The shots to grow the eggs, there are no other options. You just got to have to learn to deal with those. But I can promise you that most women say they can't do it, and they do great at it, and they become pros at it. IVF is all in the office. It's something that you don't need much time off work. It's pretty streamlined. So I would encourage you not to be fearful of IVF. The main barrier to IVF is the cost, which unfortunately can be a lot for a lot of couples. Well, I've been told that we are out of time, and I've just thoroughly enjoyed this. So I want to thank y'all for joining us. Again, my name is Dr. Jeff Deaton. I'm from Wake Forest Baptist Health, and I encourage you, if you want more information, to check our website, wakehealth.edu, or give us a call and come see us. And again, thank you for joining us.